the idea of additional testing being made available is a great idea, but this isn't going to come until January, and that seems a bit late. And 500 million may sound like a lot of tests, but if we wanted to be testing everybody twice a week, which is what Europe's been doing for a while, we'd need 2.3 billion tests a month. So it seems like maybe it's a little, too late.
Well, it's too late for certain parts of the country. Certainly the tri-state region probably is going to be coming out of this epidemic wave of Omicron by mid-January. If you look at some of the modeling, other parts of the country will still be heating up. Look, we should have been doing this all along. We should have been trying to get more at-home tests available and giving them away to consumers in drugstores, you know, allowing consumers to come into a drugstore, buy maybe 4 tests for $5, some small price, and limiting the number of sales that they can get, but making sure they got into the hands of consumers. That's what other countries are doing. They're subsidizing the test directly, allowing people to buy a certain allotment when they come into pharmacies. The other thing that we need to focus on is getting the monoclonal antibody drugs that we know still work against Omicron, the one from Vir Biotechnology and GSK, and also a second-generation drug that Lilly has, out to the marketplace. Doctors have become accustomed to prescribing these drugs as part of practice medicine now. They're going to be looking towards these, and the ones that they've been using don't work anymore. The first-generation drug from Lilly and the Regeneron drug do not appear to be effective enough against Omicron to be usable. Lilly has about 300,000 doses of that drug. It's cleared phase 2 studies. It's waiting for marketing approval. It could be granted an emergency use authorization to get that out into the market for high-risk patients. Again, doctors have become accustomed to using these drugs as a routine part of practice medicine in the setting of COVID. If they don't have these tools, that could be very difficult.
Hey, Scott, here's my frustration with this. We're almost 2 years in. You think that we would get better about predicting what we need next, making sure we're looking ahead at these things, speeding up the process for all of these things, recognizing we're still in a pandemic and kind of operating as such. And it doesn't feel like we've gotten all that much better at it, have we? I mean, I literally was talking about how I waited 2 hours outside in a parking lot last night to try and get a PCR test. Not for me, for my kids, but...
Look, these are the same discussions we were having in 2020. I remember writing op-ed articles about the need to scale up the manufacturing of the monoclonal antibody drugs. Here we are again without sufficient supply on hand, and also with testing, trying to get the rapid test out to consumers so they can do serial testing, which we know helps. We don't have the tools we have. We know what we need to do. We haven't put in place the policy preparations. There's really no excuse for it.
That's what I thought, too. Hey, we've heard from Delta, the CEO there, saying that they would really like to see the requirement for people who are fully vaccinated, who test positive for COVID, assuming it must be Omicron, I guess, because it's more mild if they don't have symptoms, if it's not a big deal, for them to be allowed to go back to work sooner, 5 days instead of 10 days of quarantine, because they need the people to help and get through. I know that Dr. Anthony Fauci has talked about potentially cutting the quarantine time for medical professionals, for healthcare professionals, because of the need in the system. Delta's saying they need it, too. Is this a good idea or not?
Yeah, look, a lot of doctors are already doing this in their routine clinical practice. If you're asymptomatic for 5 days after a diagnosis of an infection, especially if you test negative on an antigen test, and the antigen test shouldn't be used in a binary fashion to tell whether you're infectious or not, but coupled with the other elements, someone who mounted mild symptoms, has resolved, is vaccinated. A lot of doctors are using 5 days as the period in which people can sort of re-enter work. So I think it's a prudent thing to be looking at, especially for the healthcare system. But if you're going to apply it to medical workers, you should be looking at it across the board. And this is in a setting of vaccinated individuals who we know typically resolve the infection sooner.
My guess is that means, 1 second, Andrew, let me just follow up real quickly. I'm sorry. My guess is that would mean, as they've suggested, that people have to be fully masked and wearing real masks if they're coming back in an environment like that, right?
Right now, no. People are being told they can come back into an environment 5 days after the resolution of symptoms, people who are fully vaccinated, especially after they test negative on an antigen test. I know that that's going on in the real world. That's the kind of advice some physicians are giving to patients right now. So if the federal government stepped in to do this and changed the quarantine rules, look, some people can't do that because they're subject to these quarantine rules, but in settings where they have discretion, people have been doing that. So this would conform with what medical practice is veering towards.